Jamaica's COVID-19 watch has been ongoing for over 8 weeks. The numbers continue to increase, with the government insisting that it's doing all it can to contain the spread. But compared to the rest of the world, how is Jamaica doing? We do a quick assessment in this report. More than 3.8 million confirmed cases worldwide, with close to 300,000 deaths. Those figures from the Johns Hopkins University Coronavirus Resource Center Thursday afternoon. Scary figures, as the United States continues to show the highest number of cases and deaths globally. Since the first confirmed case in Jamaica, curfews, lockdowns, and new protocols have been implemented in an effort to contain the spread.
But I do believe that we're making the right decisions and that we are, in fact, making progress.
But how well is Jamaica doing? In the Caribbean region, the Dominican Republic continues to have the highest number of cases with over 9,000. There have been almost 400 related deaths there. Cuba's numbers are also high, with over 1,700 cases and over 70 deaths. For the 4 countries in the Greater Antilles, Jamaica's numbers are a distant third, with close to 500 cases and 9 deaths. Haiti has just over 100 cases, but 12 deaths. Locally, these numbers have raised several questions. Firstly, the protocols for testing for the virus. During Wednesday's press briefing, Chief Epidemiologist at the Health Ministry, Dr. Karen Webster Carr, suggested that regionally, Jamaica is doing well.
When we looked at 14 other Caribbean countries, as of yesterday's date, Jamaica ranked first with the total number of tests done. Yesterday was at 5,993. This was followed by the Cayman Islands at 3,050. But when we compare number of tests per population, Jamaica ranked 8th.
That's 8th out of 14 countries. Technically not the worst, but definitely not among the best. The ministry has since announced its new policy for all patients admitted at hospitals to be tested and for persons at risk to be tested upon request by appointment. The second concern relates to the rapid spread and the almost 500 confirmed cases. Globally, countries have spoken of flattening the curve, which means a slow increase in cases over a longer period of time. However, this graph on Johns Hopkins Coronavirus Resource Center shows a steep rise, an exponential increase in cases since April 15, when confirmed cases jumped from 73 to 125. That, of course, stems from the Alorica Call Center workplace cluster.
If we take out the workplace cluster, we are on a straight line. When we have in that cluster, we are on exponential. So that was a surge, but that is not necessarily the true surge that we were thinking about. So when that surge occurred, we went to doubling every 5 days. Currently, we are moving towards 10-day doubling, or just about a 10-day doubling. So there's some flattening that is occurring.
The Alorica outbreak led to a lockdown of St. Catherine. Despite that measure, the ministry could not locate all workers, some of whom presumably left the parish. So, how feasible is it to separate the impact of the workplace cluster on the curve from what it would have been without that outbreak? The new lockdown in sections of St. Mary is indicative of the threat of another outbreak that may put a further spike in Jamaica's COVID curve.